Healthcare in the U.S. faces enormous challenges. And for wound care providers, the demands are only growing. Every day, nearly 10,000 people turn 65 in this country. And studies show that up to 14% will develop a chronic wound at some point. Some wounds may last months, others, years. You've seen it, so have we. At RxWound, we're not just watching from the sidelines. We're advancing what's possible and leading the charge in regenerative approaches, including research on exosomes in controlled clinical environments. No, we don't use the word miracle. But anyone working at the frontiers of science knows. Discovery often carries a sense of the mysterious, like Kekule's dream of benzene. Or the kind of breakthroughs that start as intuition and evolve into impact. If you work in wound care, ask yourself, what would it mean to witness a chronic wound begin closing? One that had persisted for over a decade? To see patients regain their independence. To taper off medications that once seemed lifelong. To see tears of relief instead of pain? These are the kinds of cases being reported in the field. And we're only getting started. Now let's talk about something practical. There's a Medicare-supported care pathway that enables remote monitoring and coordinated wound support. And yet, only 4% of providers are currently enrolled. This isn't just about longevity. It's about quality of life. It's about improving clinical outcomes through smarter, connected care. You don't need to buy equipment. You don't need to retrain your staff or overhaul your practice. The model is turnkey. You keep doing what you do best, healing wounds, while support systems manage the operational side of remote care. Why would CMS back this level of infrastructure? Because the outcomes are undeniable. Studies report up to 76% reduction in hospital readmissions, GitNux. 44% drop in ER visits, DovPress. Billions saved annually for the US healthcare system. And a 90% boost in patient satisfaction, University of Pittsburgh. At the end of the day, better care benefits everyone. Patients, providers, payers, and the healthcare system as a whole. We host a national call every Tuesday at 6 p.m. Eastern. For wound care professionals like you, who want to explore how this works, ask real questions, and see real case studies. Sign up to register. It takes 10 seconds. You'll get a brief intro video and a calendar invite. At RxWound, we believe in a better future for wound care. One built on data, compassion, and the courage to innovate. If improving outcomes is your mission, let's talk. We'll see you Tuesday at 6 p.m. Until then, take care, and thank you for what you do.